Hey everyone, it's Nurse Dani, and today I have Dr. Alden with me, and we're going to talk about the flu. But first of all, before we jump into the topic, I want to have Dr. Alden introduce herself to you. And while we're talking today, feel free to write any questions you might have in the comment section, and we'll get to a few of those later after we discuss the flu. So Dr. Alden, tell us a little bit about yourself. You practice at Altaview Family Medicine in Sandy, Utah.
Yep, that's right. Hello, everyone. So I'm Dr. Heather Alden. I'm just started a job at Altaview Family Medicine, and it's pretty exciting. I just finished residency and medical school at UCLA, so we're excited to be back. My husband and I both have connections in Utah, so we wanted to come back, be close to the mountains, and just kind of be around family too. As far as kind of what I focus on, family medicine, a lot of people don't know exactly, what they treat or who they can see.
It's kind of the hub for everything.
It really is, yeah. So, we see anything from pregnant women, young children, even newborns, all the way up to, elderly and geriatric population. So really we have the most wide spectrum of medicine. And so flu vaccine is a perfect topic just because, it really applies to everyone.
Yeah, every single member of the family, from the smallest and youngest to the oldest.
Exactly. So thanks for having me. I'm excited to talk about it a little bit more.
You're going to be a great wealth of knowledge for everyone. So let's start with the simplest of questions. What is influenza?
Okay. Influenza is a virus. It's a type of virus that's specifically a respiratory virus. So a lot
of people say I have the flu and they're referring to a stomach bug. But
totally.
Influenza is respiratory.
Yes. Yeah. Influenza is a respiratory virus. And it's a little bit tricky sometimes because they do kind of cross. When they say they have the stomach flu, it could be, some other type of bug or another virus that causes it. But influenza, which is a respiratory virus, sometimes can cause a little bit of just kind of stomach upset and a little bit nausea. But most of the time kids have those symptoms and adults usually have the respiratory type symptoms.
So coughing, fever, body aches.
Exactly. So kind of the time course, and it's very similar to the common cold, so it's a little hard to differentiate.
Yeah.
But the first few days you get fever and body aches. Those are kind of
usually a high fever?
Not too high. It can be low, yeah, and it just depends. Higher risk or kind of more vulnerable populations may have higher fevers.
And let's define that, vulnerable population.
Yeah. So any kids under the age of 5, they're just a little bit more prone to having really more severe complications.
Their immune systems are still developing.
Exactly, yeah. So anything under age 5, anything above age 65, so the elderly population, same thing. Immune systems aren't as strong. And then anyone with a heart condition or a lung condition, asthma even, or if they have liver problems, diabetes even, just because your immune system's a little bit
Or some people
weaker.
may be on medications that suppress their immune system.
Exactly.
And pregnant women.
Yeah. Which I know is a lot, of what you discuss with moms. So all of those people are just higher risk, and they may have higher fevers, more body aches. The flu might kind of cause them to have longer symptoms too.
Longer symptoms. Okay. So when do you call the doctor? So what's the difference between I think I have a cold, I don't feel very well, and then when do you go see the doctor?
Right. That's a tough question just because it's a lot of times very similar to a common cold, and most of the time the treatment for that is rest,
talk about supportive measures for people out there who might be having a cold right now. What do you do?
Right, exactly. So kind of when do you decide to go to the doctor, and then kind of what can you do? So usually a common cold or even influenza should only last, a week of kind of more severe symptoms, and then you can have cough and body aches and just feeling tired and run down for 2 weeks even.
And are you transmitting it? Can you make someone else sick during this time?
Yeah, so usually the highest kind of transmission time is at the beginning. And so it's usually the first 3 to 5 days when you're having symptoms that you're really, prone to giving it to other people. So that's the time that you really should kind of stay home from work, not go to school, keep your kids home from school.
No one thinks you're a hero for going to to work when you're sick.
No.
The opposite, right? Everyone's annoyed.
Exactly. I know. They're like, stop coughing. We don't want to get bugs or whatever. So it's just better to get, and some patients, they come and try to get a doctor's note just so they can be able to stay home a couple of days and rest. So if that's the time, come to see, your doctor and get a note and just make sure that things are going well. If you decide to kind of stay home and just kind of do your own thing, the time that you really should come to the doctor is, I would say, after 1 week, after 2 weeks. If your symptoms still aren't getting better, it's kind of on a good trajectory.
Now, it's so important to understand a cough may not get better for a while because when you got sick, it damaged your airway, and so those cells need time to regenerate, and that's why you have a lingering cough for a while, so it doesn't mean you're still actively sick, right?
Right. That's the hard part, too, is that people are like, oh, I still have a cough. What's going on? I must have some sort of crazy, infection. Or
we talk about whooping cough all the time, too.
Right.
So, I mean, sometimes people are like, oh, it turned into that.
Right. Yeah, but it could just be a lingering cough. And the virus really affects all of the skin cells, and your body takes, weeks to really regenerate and go back to normal. So you're going to have a cough for a little while, which is not fun, but it's kind of just the time course of the disease.
It's important to understand for yourself and your little ones, especially.
Exactly. And little ones, too, they might have it a little bit longer. They're still kind of coughing, here and there, or they might have...
And they might get sick again right on top of it.
Exactly.
I mean, correct me if I'm wrong, but kids get like 6 to 9 colds a year, right?
Oh, it's so terrible.
And it's usually packed into like a 6 or 7 month period. So right after they get better, they get sick again.
Exactly.
And again, it's just because they're being exposed to all these new things, and so they're going to get sick. But as they get older, like we get about maybe 3 to 5 a year, right?
Right.
Because our immune systems have seen these things before, and we can fight them off.
Have a little bit more of the antibodies and, things to fight off. Yeah, I mean, poor kids, just because they're in school, they're in kind of that environment that they're constantly passing things around. And, hand hygiene, all of those things may not be perfected yet.
Right.
And so you're just going to pass it around. And it's hard because, you might not get completely better and then you get another virus.
You never got fully up to speed again, and so that may make it last a little bit longer the second one.
Exactly. So when do you go see a doctor? As a parent, as, a patient, your body best and your child best. If things just aren't looking like they're getting, in the right direction, or if fevers are persisting for longer than 3 days, I would say that's the time to really go see a doctor.
For an adult?
I would say for both. For child and for adult. Because usually fevers should only last, 3-4 days. If it's lasting longer than that, or if it's spiking, really
It's
high.
dangerously high.
Well, so little kids, they can go up to 104, and that's still appropriate for like a, respiratory virus. And you want fevers just because your body's fighting off that illness.
Yeah, a lot of people think they're terrible, but it's actually part of the process.
It's part of the process.
Yeah.
Your body's really trying to, because viruses like cold environments, and so your body really elevates that temperature to be able to kill off the virus. But for little kids, when they have fevers, up to 104 higher, they can get like febrile seizures and all of those things. So that's why you should kind of give Tylenol to bring down the fever.
Should you alternate Tylenol and Motrin?
So, couple of things. There's been some research just for little kids. Tylenol is usually the best thing to do first, just because there's less complications and less side effects from it. But as they get a little bit older, and usually I say kind of after age 5, you can start doing kind of Motrin a little bit more. And Motrin is perfectly fine too. It's just sometimes if patients take a little bit too much of it, they can kind of have more adverse effects. It can affect the kidneys, all of those things. So
probably a good rule of thumb is if your little one's sick, like if you have a baby under the age of 1 or a young toddler, call the pediatrician and they can give you advice on what to do, how much to give, because dosing is based on weight and they would know that information.
Exactly, yeah. And there's lots of different charts for medications that, your doctor can provide for you. And you don't you don't want to go off of just their age because, like you said, it's weight-based.
Yeah.
So those are kind of the things that you can do to help. And then never give aspirin for a young child. Even under age 16 is the cutoff because aspirin can cause complications. So just stick to Tylenol, Motrin are the best things.
And what about like cool baths, like not hot, but like kind of try to cool them down a little bit with a cool bath?
Yep. So kind of help bring down the temperature. It's also comforting for muscle aches. And then another thing, just lots of rest. And
hydration.
Hydration. That's exactly what I was going to say. Dehydration is one of the complications, and little kids especially are so susceptible to it because they just have a poor appetite. They're just not drinking as much. So
and
whatever
especially
you can
babies,
do.
if they're all stuffed up, then they can't breathe and they have a hard time like nursing and sucking and breathing. If they're to that point, you should have them seen, right?
You really should have them seen. If they're not feeding kind of on a regular basis, if they're not getting, at least either a few ounces, and it depends on the age too, but, and then when they're little in wet diapers, you can kind of gauge how much they're, urinating, and that tells you how much their hydration status is affected. So little kids, watch for signs of dehydration, watch for really high fevers that are persisting after 3 days, and then the other complications I was going to bring up is ear infections. So watch for your kids kind of pulling at their ear or complaining of pain or headache or just really, really fussy, after a few days of illness. You should just get them checked out because ear infections can be a complication. And then the other thing is pneumonias. Not as common, but it can happen if their fevers just keep on spiking or they're having trouble breathing. Definitely go see your doctor.
Good to know.
Yeah.
So, when it comes to breastfeeding, kind of touched on that.
Yeah.
Say I'm a nursing mother and I get the flu. I'm not right now, but
okay. Yeah.
Say I am. So say you got sick.
Yeah.
A lot of nursing moms are afraid to breastfeed their little ones while they're sick, but you actually should continue nursing. Talk about that.
Yes. So, as a nursing mother, actually right now I have a 7-month-old, 8-month-old. And so I get questions about this all the time, just, with my friends and stuff. When you get sick, your body is building kind of antibodies against that illness, and all of those antibodies are going through the breast milk. So it's actually helping your child when you nurse even more, just because they're going to get all of that immunity and good stuff from the breast milk. So you really shouldn't stop. And, if the baby is exposed to it, or if the baby also gets sick, it's even more important for that hydration status too.
Yeah.
So definitely don't stop. The virus usually, won't get transmitted. It's more the antibodies that will go through the breast milk, and your baby needs that.
So talk about how the flu is spread and how we can prevent the spread of it.
Yes. So this is influenza specifically, and it is a respiratory illness. So the way that you spread it is just through respiratory kind of air,
coughing,
droplets.
sneezing.
Exactly. And, saliva, body fluids,
sharing
that type
foods,
thing. Sharing foods. Yep, exactly. There are other kind of viruses that are a little bit more like foodborne or handborne, but even so, hand washing is huge. And when you do have a cough or all of those things, when you're around, that high risk population, make sure that you're either wearing a mask or keeping things covered, not sneezing and coughing. I know it's hard with the little kids, though.
It is. It really is.
Yeah.
Teach them to sneeze and cough into their elbow. If they use a tissue, have them put it in the garbage right away and then go wash their hands. And as a mom, when my kids get sick, I'm like running around the house with, like decontaminating surfaces that everyone touches a lot, doing everything you can to prevent it. It is possible for one person in the house to get sick and not everyone else, but it is hard.
Yeah, definitely.
Because you live in close quarters.
Yeah, exactly.
You share things.
Yeah, exactly. So it's really important. But you're going to start sharing things. Yeah.
So what about proper hand washing? It's not enough to just turn the water on, go like this for a second and be done, right?
Yep. So kind of lukewarm, warm water, and it has to be at least 20 seconds is what they say.
Yeah, teach your kids to sing happy birthday or the ABCs and do it yourself.
Yes.
That's longer than you think.
My gosh. My son's really funny. He'll sing really fast, so it turns into 5 seconds. And I'm like, no. So
proper speed.
Yeah, exactly. Proper speed, or maybe sing it a couple of times. depending on that. So they turn it into a little game, and it's kind of fun. So do whatever you can to get your kids to just hang out there and go, and really get the bubbles and the suds and really cover all the surfaces of their hands too.
So one of my fears is grocery carts.
Oh,
I hate grocery carts. They are disgusting to me. So I appreciate when stores have wipes.
Oh yeah, totally.
But like, say you're at the grocery store, you can bring like some alcohol-based hand sanitizer and use that too, right?
Yeah, you
That's
can
the
totally
next best
do
thing
that.
to hand washing.
Yeah,
You can
exactly.
use that out in public.
Totally. And same with your kids too. You can kind of wipe their hands, especially after coming back from school, before they're eating. Doorknobs too, just really crucial. That's a really and faucets. So all of those things, just carrying around a little, alcohol like sanitizer and just kind of wipe things off. But yeah, grocery carts are kind of disgusting.
So flu shots, that's another important thing to do.
Yep.
Talk about that. Who should get it and who shouldn't?
Okay. So most everyone should get a flu shot. Babies under the age of 6 months, their immune system's just not quite strong enough. So getting a flu shot, they really won't mount a response to it.
So it's not harmful, it's just not helpful.
Right, exactly. And their antibodies just don't really build up enough, and they can still, get affected from it. So we usually don't recommend before age six months. But anything above 6 months, and everyone should get it. Elderly population, they get a slightly higher dose just because they need that.
And elderly, is that 65 and older?
Yep. So 65 and older, and they are kind of just higher risk. And then who else should get flu shots? That's pretty much it.
Pregnant women.
Pregnant
should
women.
get them for sure. I have so many people ask me, I'm pregnant, should I get it? And we warn against medications during all of pregnancy, especially, during certain times like the first trimester. So a lot of people then think, well, I shouldn't get a flu shot in the first trimester.
Because it's like a medication.
You should. Yeah.
You definitely should. And well, I'll kind of go into like what is a vaccine really, because the flu shot that they develop, and there's a couple different kinds, but the main one that they give is basically parts of the virus that they've killed off. And
so it's dead. It will not make you sick.
Totally dead.
We've had heated family discussions over Thanksgiving about this, because I'm like, of course I'm telling all my family to get their flu shot. And I have a family member who's like adamant that she will not get one because everyone she knows gets sick, but that's a myth.
It is a myth.
Okay.
And it's so hard just because colds, other viruses are always going around during that season. And so it really is just kind of coincidence and bad luck if you do get sick kind of right after the flu vaccine. And also the flu shot, it has those viruses and they're kind of broken up and totally dead, and they really can't cause the damage to the airways or all of that stuff. But the good thing is your body can find those little pieces and build antibodies against it. So when your body's trying to work hard doing that, you can kind of have a low-grade fever maybe sometimes and just feeling a little tired because your body is working hard to kind of build up the immunity, but you can't.
So one of those things where you can tell yourself, not a bad thing, it's a good thing.
It's a good thing. I'm doing this and I'm going to be a little bit stronger, if I do get exposed to the actual flu. But pregnant women, going back to that topic, definitely should get the vaccine.
And when your body's building up those antibodies, then they can pass to your baby, and within a certain time, if you deliver, within about probably 6 months or so of getting it, then it can benefit your baby too and offer them some protection.
Exactly. Yeah. So, your body's going to build up those antibodies, and those pieces of the virus won't pass on to the baby. And there's really nothing else that could really harm the baby from the vaccine.
Just the antibody.
Yeah, just the antibody. So that can go through, and then the baby, and you're also protected when you do have the baby, when you're nursing.
You don't want to get sick and pass it to them like we just talked about.
Exactly, because they're such a vulnerable population. So definitely key. Pregnant women really should get the vaccine. Other people, so people who shouldn't get the vaccine, we talked about under 6 months. If you have a really severe anaphylactic allergy to maybe getting a flu shot before, throat closing up, not able to breathe.
This would be to some additive in vaccines in general?
Exactly. So it's either an additive, or sometimes people have egg allergies because the way they make the vaccine, it's based on kind of egg protein and how they culture it. So if you have a really anaphylactic allergy to eggs too, let your doctor know. And there's actually different vaccines that they can give you without that.
Oh, good to know.
Yeah.
What about the flu mist? That's been an option in years past. Sometimes it's not. Talk about that.
Okay. I know a while back it was really popular just because for little kids, not wanting to
better than a shot.
Yeah, not wanting to get that needle. But the CDC has definitely found that it was not effective whatsoever. And so they don't recommend it anymore because it really doesn't get that immune system building up a bigger response. So,
my kids, it's funny. I just went to take them to get their flu shot a couple weeks ago, and I'm a firm believer in telling them what they're going to experience, rather
Instead
than just surprising them.
Yeah.
Some parents, say that that's better for their child, but we talked all about it. I told them why it was good and it would be way better than getting sick. And, my kids are 9 and 5. So my 9-year-old daughter was talking to my son and she was like, I'll go first and tell you how it is and show you that it's not that bad. But really then she looked at me, she's like, will you hold my hand?
I don't want to do this.
And so you can do anything if you hold someone's hand. And then after it was done, they were like, was that it? It's really not bad.
Yeah, exactly. Yeah. And it's funny because I sometimes have adult patients too that just have such a fear of needles and they don't want to get it. But honestly, it in the long run, it's so much more worth it, and the benefits are way higher than getting the actual flu because of those complications we talked about. And and that's the other thing too, is that adults say, well, I'll take my chances. I'll get the flu. It's not so terrible,
it'll put me under for a week or two.
Right. That's it. Right. But I tell my patients, you really got to think about, who are you around? Are you around young children? Are you around, older, elderly, or, people with chronic conditions?
So if you're not doing it for yourself, do it for them.
Yeah. And most of us are, around those kind of patients and people. So I just say it's totally worth it to get it so you can protect. It's all about the population and kind of preventing a pandemic of flu.
And kind of squashing it in the population.
Exactly. Yeah.
So, is there anything else about flu shots that you think that we should know in particular?
I think
what about when they develop it? How do they come up with the virus that they're going to vaccinate against?
Right.
What's that process like?
I'll kind of talk about kind of the different kinds of flu. So there's influenza, and there's 3 different types, A, B, and C. A and B are a little bit stronger, and they're the ones that you hear about that get spread. C is kind of like more of a common cold. And then within those groups, there's the H proteins and the N proteins. So like when people hear the H1N1 or all of that stuff, exactly, that's telling us which of those proteins it has. So a flu could have, H2N1 or, different combinations. Yeah. So every flu season, there may be a different flu that has a slightly different combination of those proteins. So the CDC, who kind of develops all the vaccines and tries to figure out what's going to be the next strain, they look at those different subtypes and they say, okay, maybe this year this was a little bit more prevalent.
Things tend to cycle, right?
Exactly.
So we can go kind of off history.
Exactly.
And so the best thing we can do is predict. But even if you get a flu shot and you catch a strain that you weren't vaccinated for, the course is still going to be milder and less severe, right?
Exactly.
So there's still benefits.
There's still benefits.
Catch other strains.
Right. Even if it's a really, a vaccine that just didn't protect as well, it's still beneficial just because it will bind to some of the proteins and you'll still have that immune response. It might not be as strong, but it's still better than if you just hadn't gotten the flu shot at all.
Yeah. So where can you get the flu shot? If people are hearing, hopefully everyone's thinking, oh gosh, I need to go get one. I need to get one for my kids. Where should you go?
So lots of different places. Most pharmacies will have it. As you can, go to Smith's or whatever, you'll see signs for the flu shot. So most pharmacies, obviously your doctor. With Intermountain, there's actually a campaign that basically any primary care clinic or even specialty clinic, even if you're not a patient, you can just show up and get a flu shot there.
Oh, that's great. And what about insurance coverage? Do most insurances cover the cost of it?
Definitely. So it's all preventative. So I always tell my patients this is billed under a certain way, and most insurances have preventative services and they should be totally free. So
No good reason to not get
No
one.
good reason. And then the last thing is, if you really don't know where to get a flu shot, the CDC has a website. It's vaccinefinder.org.
Oh, that's helpful.
And it's awesome. It basically is like Google Maps, and it'll just pop up and show all the different locations, like, Target or, grocery stores. Sometimes they'll offer it.
I was just driving down the street the other day. A lot of times places have banners and signs saying that they're offering flu shots.
Right, and some of them will say like, oh, we'll give you a gift card or something.
Yeah,
so hey,
take
might
advantage
as well.
of one of those.
Right?
2 for 1.
Exactly.
So when it comes to treating the flu, we talked about this a little bit off camera. I think this is helpful for people to know too. When is the flu treated and when is it not? Because we started out discussing the fact that it's a virus.
Right.
Viruses typically aren't treated, but there are antiviral medications that can be given. So when would they be given and prescribed by a doctor?
Yeah, so occasionally there are, situations where we do treat, and most of the time it's for those higher risk populations. So pregnant women, when you get the flu and it's confirmed and your OB just feels like, okay, the flu is going around.
So maybe you should talk to them sooner rather than later if you think you have a bad cold so that they can test you.
Exactly. If you're having fevers, if you're feeling sick, definitely go in to see your OB and figure out. And so usually doctors will treat pregnant women just to kind of prevent it from getting more complicated. And then people in the hospital, if they come in with like a really bad respiratory illness and it's turning into something, they'll usually treat them there. And then nursing homes or like long-term care facilities. If one person has the flu, it kind of spreads, and so they'll just treat everyone with it. But most healthy adults and children will clear it on their own, and they don't need that medication. And you kind of have to treat it within 2 days of starting symptoms. So most of the time we don't even...
That's at the point when you're still wondering, do I have a cold or do I have the flu?
Yeah, so you might not even see your doctor then. And after that, the medication doesn't really do as much. It might shorten the course, but, that's pretty much it.
So we've talked a lot about vulnerable populations, and one of the things we focus on Intermountain Moms is babies.
Yeah.
So this is maybe a little bit off topic from the flu per se, but can we talk about RSV? Because like when you have a baby that's sick, when do you know when you should get them checked out? When is it more than just a cold?
Definitely. So it kind of is similar to the flu as well. When you have a baby, you'll start to kind of see when they're working harder to breathe. When they get a virus, sometimes they'll just have, kind of, boogers and kind of stuffy nose. They're having a little bit trouble kind of breathing through their nose, and they might have fevers as well.
And small babies are nose breathers. They don't instinctively breathe through their mouth, and so that can be a really bad thing.
Really hard, yeah. So the things I tell parents to watch out for is just kind of the work of breathing. If a baby is just gasping for air, not sleeping well, if they're kind of using their muscles to really try to breathe, that's a sign that you really need
healthcare workers,
to...
we've all seen
It's so sad.
retractions, but to explain it to someone, it's like when their little chest is sucking in.
Exactly. They're using their abdominal muscles to really get that air in. And babies especially, you can see it, and you'll start to see kind of muscles here.
So undress them perhaps and just watch their chest. See if they're breathing evenly or if they're breathing too fast or look like they're working hard.
Exactly.
Not eating well.
Right. Not having enough wet diapers.
And how many is enough?
So, usually I say 8 in a day is a good number to kind of go off of. If they're really down to like 2, 3, that's really not enough for a baby.
Significantly less than what they usually have.
Exactly.
Difference from their norm.
Yep. And then you'll start to see babies won't really make tears when they're just fussy and crying, but nothing's coming out. They're not really having tears. That's a sign that they're really dehydrated.
Sunken soft spot.
Totally.
That looks different than tiny.
Exactly. So those are all little things that you'll see. And with a baby, I just err on the side of, more conservative. And so if you just notice your baby having a little bit trouble eating, drinking, do it rather, sooner.
Lethargic,
yeah. Don't wait until they're totally at that point. If you're just questioning it, just go to your doctor or pediatrician right away.
And what can be done?
So if a baby's really dehydrated, they can definitely do hydration. And at home, you can also work on this. If, nursing is too tough, there's supplements that we can give. There's ways that we can hydrate little kids and babies. And then sorry, I lost my train of thought.
No, you're good.
What else can be done?
All you can really do is support them through it. You can't treat RSV, but it's going to run its course, and during that time, they might need supportive care like suctioning, hydration, and sometimes this can be managed at home, but sometimes it needs to happen in a hospital setting.
Yeah, exactly. And some babies are just a little bit more susceptible to RSV, like ones that might get asthma in the future. They're just a little bit more prone to, maybe needing some asthma medication, needing, whatever. It can develop into a pneumonia. So those are all things that...
Or maybe you have a premature baby or something like that may have already some compromise.
Right. Yeah, the lungs are just not quite mature enough. And so anything that affects it, it just kind of, really takes it down. So just watch out for signs of dehydration. That's kind of usually the first thing. And then also just watch for their breathing.
Breathing and dehydration.
Yeah.
Good to know.
Yeah.
Do we have any questions? Nope. Okay. We haven't gotten any questions live, but I think this has been a great discussion.
Yeah.
This is great information for everyone, and hopefully everyone's thinking about where to go get their flu shot now.
Definitely.
And if you guys do have more questions about it, you can leave them in the comments section below. And of course, you know where to find me on Facebook.com/Intermountain Moms. And Dr. Alden, thank you so much again for being with us today.
Thanks for having me.
Okay, tune in a couple of weeks for our next live stream, and have a good day, guys. Thanks.